Mary. Hi, everyone. Good morning. Happy end of summer, early fall. I can't believe we're here. Everybody able to see my slides? My computer's being a little funny. Can you see full screen slides? Okay, great. They updated Zoom and I updated my computer. Well, today we're going to chat just a little bit, some a little intro to involving young family members in care, and so in the work that you're doing. So our objectives for today is to really identify some common needs of these younger family members based on their age and developmental stage. We'll break that down just a little bit, and identify ways to thoughtfully and proactively involve these young family members in treatment, or some things to think about. So, as we go through today's didactic, thinking about how many individuals with whom you work that have younger family members in the home, either children, siblings, what do you know about these younger family members and their relationship with the individual in treatment, the dynamic in the home? Have they ever been included in services in the past? Not really for themselves, but that involve the individual with whom you work. And then keeping that in mind, because we know that families are very much a part of the system. And so I think, chatting about this a little this morning just kind of hopefully we'll get the wheels turning. So obviously, I think I say this in every talk is, start by thinking systemically, thinking about the family system. So young family members both impact the system and are impacted by the system. And this includes being impacted, obviously, by the individual, their experience with mental illness, and as well as the young family member's response to that illness, which can, again, in turn, impact the individual in treatment. So that constant reciprocity, that circular motion that we will see within family systems. So when you're considering, involving family members, some initial thoughts, that I would encourage you to think about to see if this is the best fit is, the individual in treatment, the individual with whom you work, what's their preference or level of comfort for involving these younger family members? What's their degree of involvement with the younger family members? If they are not the parent or guardian of that younger family member, what is that parent or guardian's feeling about involving that young family members? Thinking about the young family members, how they fit into the system. Are they biological children? Are they the individuals in treatment, step sibling, half sibling? Is there adoption within the family? Is it a blended family? Other services the young family member might already be receiving for themselves. Considerations, obviously, for safety, and if there's any history of children's services involvement. So thinking about the impact of mental illness of an adult in the home on these young family members, it's really dependent on a number of factors here, and I just wanted to chat a little bit about a few of them. Their age and their birth order can really affect how they are impacted. What was their relationship with the adult in treatment prior to a mental illness diagnosis, or has this always been just the way it was and all they know within the family system? The young person's personality, temperament, level of resilience, the nature of the loved one's symptoms, their course of illness within the symptoms. Are they an individual who has a number of hospitalizations? Are they an individual who have had police called to the home? All of those kinds of things. Do they reside in the same home? Does one wish that they were able to reside in the same home, but there's divorce or separation or something within that family unit? And what is that young person's level of external support, social support? So are they really, maybe at home things are difficult right now, but they have a really strong church family that they are steeped in and that they feel supported with there. I also think it's important to talk about, what family members want to know. And this really does differ in what they're prepared to know. And this really does look different for various age and developmental stages, with how much information to provide, how to present that information, and then how to be supportive of that young person's need. But involving young family members with the adult in treatment can really provide an opportunity for open communication within that family system, destigmatizing mental illness, breaking through some of those myths that maybe the young person has heard through others in their life, maybe from school, about mental illness, and really normalizing their experience that mental illness is not as uncommon as people may think. It's just something that people don't talk about as often. And also, having a young person involved allows the adults to share important information, and then they can offer support to the young person, and they can offer guidance to the young person. But I think a really important piece that, we can talk about is, oftentimes the adults in the home, including the individual in treatment, don't know what to share, how to share it, what signs to look for that the young person might need more information or might be in distress. And so those are all things that it really could benefit this whole family system when you're working with an individual one-on-one in treatment. So there are, I think, some commonalities across ages and developmental stages. Everyone needs developmentally appropriate information, but I think the key here is that they need some level or some degree of information. They really need support for normative development. And what I mean by that is really having an opportunity to get their safety needs met, to know that they're safe at home. They have a right to feel safe at home, get their physical and emotional needs met, education, be able to start individuating as they grow and as they, increase in age, and to be able to have fun. And so those normative developmental things, how do we ensure that that's happening for the young person, and how does the individual in treatment and other adults in the home support these activities? All young people need a listening, non-judgmental, non-reactive, I can't highlight that enough, ear. They need honesty about what is going on within the family system and with the individual in treatment. It's just to what degree or how much information is shared. Obviously, they need reassurance. They need to feel safe. They need to feel supported. They have to have some sense of normalcy. They really want to see their loved one engaging in self-care, because we know when an individual is taking care of themselves, it has a positive impact on the rest of the family. They need some help to understand how they set limits and understanding what their boundaries are, even as young people. And then any kind of trauma experiences they may have had, and they need assistance in knowing it's a safe space to process that trauma. So just a couple slides breaking it down from, these sort of age categories. So when you're thinking about really young ones, infants and toddlers, and most likely it's bringing a new baby home. And at that time, it's a transition for everybody in the home. There's lots of noise, there's lots of care, attention's given to the new baby rather than others. There's a high degree of stress. And so how is that impacting the system, and how is that impacting the individual with whom you're working? We know that even young children are often really impacted by a new baby coming home. And so, if they're already feeling like there's a high degree of stress in the home or tension or a little bit of chaos in the home, and then we add a new baby to the picture, just thinking about how that's impacting that young person. If that young person, will talk about their responses to this stress, that can increase the stress levels for the individual that you see in treatment. So the goal is really, as much as possible, to minimize the stress in the home. When we get a little bit older, that preschool age, their needs are a bit simpler, but they still importantly, very important to understand that they still need some degree of information. So when you're thinking about the little ones, they may need fewer details and less information, but they still need that information presented to them in a way that they can understand. So explanations typically will use simple words, stories, or pictures that help them understand. They really have an ability to focus on things that they can see. And so, whatever they see, they will respond to. And so talking with them about things they might observe in the home, things that they have seen, how do they make sense of that? What's their level of understanding? And try to meet them in that space. But this age, they do require a great deal of reassurance that, they're okay, their loved one's okay, their family is okay. When we go a little bit older to that elementary school age, they're a bit better able to express their feelings. And so, they're most likely going to want a few more specifics, and they're going to have a lot more questions, which can really be distressing to adults in the home, including the individuals with whom you work. And so being prepared for many, many more questions, and questions that are a bit deeper. They're going to have a lot of concerns about safety for themselves and others close to them. So they need that safety reassurance, understanding safety plans, all of that information. But their questions and concerns are going to be pretty black and white, pretty straightforward. And so in turn, their answers, your reply as an adult in the home or the individual in treatment who's an adult in the home, making sure that answers are direct and straightforward, but they're also simple and they're direct, and making sure to be honest, but being mindful of the degree to which you disclose information. They want to know practical information about the illness, but more importantly, they want to know what to expect. And that can be a really tough one to answer because it's, none of us can necessarily say what things are going to look like in a day, a week. And so how do you have that conversation with a child this age? But reassuring their concerns, validating their feelings, and oftentimes because their attention spans are a bit shorter, you have to have shorter discussions or smaller conversations over time. So, helping the individual in treatment or other family member, loved ones in the home, adults in the home, being prepared that you can't sit down and have a 30-minute talk. It might be smaller pieces of information over time that the kids will respond to a bit better. Teenagers, they can typically handle more detailed information, and they're going to ask more questions, and they're going to be more difficult, and they're going to be more specific. However, teenagers tend to talk when they are ready. So this is about helping the adults in the home find their moments, and having an awareness of when a teenager might have opened the door for a discussion. They're likely to already have some information about mental illness from friends, school, media, social media. And so it's really important to kind of assess and evaluate, what do you know, or what do you think you know, and ensuring that they understand which is accurate and which is misinformation. And even if information is accurate, what actually applies to your loved one with a mental illness. They respond best to really open dialogue or reciprocal communication. So instead of talking at them, really engaging with them, providing them with literature, age appropriate literature. Sometimes, teenagers will need to take it on their own, read it on their own time, digest it a bit, and then have an opportunity to come back and talk about it. Again, honesty is really important. And then encouraging them. We all know that teenagers, that's a time in life when typically they look outwards to peers who have the most influence on them, or coaches, or teachers, or other, mentors. So really encouraging them to talk with others in their lives outside of necessarily their immediate family, with whom they feel comfortable and safe and supported. And that can be difficult for adults in the home, to know that, sometimes it's airing their business. And so what is everybody's level of comfort with what's shared outside of the home is an important discussion before, a teenager does this. And, the adult in the home is upset, and then the teenager starts to hide things. And so we can see how that can snowball. So really important to have those discussions about, information shared outside the home, so that the teenager feels like they can feel supported from others external to necessarily the immediate family. So some common reactions sort of across the age groups are, feeling anger. This may be acting out, getting into some trouble. The anger, I think it's important to note that it can be directed externally or internally. If it's external, it can be at parents, siblings, teachers, health professionals. So really encouraging adults in the home to keep an eye on that. Feelings of hurt, envy, resentment, frustration, that feeling of loss or grief. Oftentimes siblings of a client will experience survivor guilt. So why was it my brother that has an illness and not me? Those feelings of shame and sadness and embarrassment, even fear of what's happening. Feeling, if it's a sibling of the individual you see in treatment, feeling like, they have to be the well child. So what does that look like? I can't cause any problems. Everything has to be perfect. And that can lead to a lot of anxiety and perfection seeking in that child. And also feeling like they have to take on the burden, they have to be there for everybody else. Common stress responses are sleep difficulties, concentration difficulties, crying, loss of appetite, withdrawal from, social networks and from the family. As I mentioned, fear and worry are really common for themselves and their loved ones. And so I think, you know, something important, no matter what the age or developmental stage, is that understanding the illness is not contagious. If they've heard about, you know, the hereditary component of various mental illnesses, understanding that this does not have to be the case for them. It does not mean that, for example, they'll develop psychosis, and there are a number of factors that contribute to that. And so how to help send that messaging if one of the children have heard about, you know, because my dad has this, does this mean that I'll get it too? And having that conversation in a developmentally appropriate age, but helping the adults be prepared for that. Oftentimes they want to know, when is my loved one going to be better? And these young family members will blame themselves. So I did something wrong. I did something to cause this. I keep causing this to happen. So they need reassurance that, you know, they are not responsible for the individual's illness or wellness, but there are things that they can do to be supportive to their loved one with a mental health diagnosis. You know, they're oftentimes kiddos think that if I just work harder, if I'm smarter, if I do better, if I just can behave, my loved one will get better. They have this idea that they have these magical powers. If I just do everything right, things will be okay. And we know that that's not going to be the case. So this can lead to a lot of frustration and disappointment and anger. And, you know, so it's really just reminding them that mental illness is no one's fault, including their own. Reassuring them that they're not alone. They have the right to feel safe. Considering the behaviors or the reactions of these young family members and how that to the individual's mental illness, and how that impacts the rest of the family, and how that impacts the individual with the mental health diagnosis. And so really thinking about your role as providers and clinicians within all of this. So how do you support a healthy home environment? Because we know that if you're working with an individual, if the home environment is chaotic, or you know, there's high levels of expressed emotion or high levels of stress, it's really, really difficult, no matter what wonderful work you do in session, for that person to achieve the level of wellness or potential that they have. And so really thinking about and considering and potentially addressing that home environment and the people in that family unit is incredibly important, even for our adult clients. So, you know, although, you know, I mentioned there are commonalities in children, regardless of their relationship, even their sibling versus a child of a parent with a mental illness. I just wanted to highlight that, you know, for most of your clients, I assume that they would be the parents of a child in the home. And so when it's a parent-child relationship, these children often have a higher level of anxiety and fear than if it were their sibling. The child may be more likely to take on the role of a parent, or feel like they have to take on more responsibilities. And it also can impact the parenting style and the dynamics within the home when there is mental illness within a parent, regardless of the age of the child. So, you know, how often you might involve children, in what ways, to what degree, that's really going to be variable, and, you know, case by case basis. But some things to think about are the level of need, everybody's level of comfort in involving these individuals. What are the dynamics like within the system? What's the age of the child in the home? And, you know, what are the treatment preferences of everybody that's going to be potentially involved in this work? So if there is interest, we can always do a follow-up to this where we talk about, you know, more things that providers can do to engage young family members with your adult clients, and how they can support those young family members at home, but also about what young family members can do to support your adult clients when they're in the home. So if there is a level of interest, you know, let us know. And that could be, you know, a follow-up didactic that we do later on in our series with this ECHO. So I've noted here some really important resources. So if you have an adult client, you know, with a sibling who might be a teenager, or they're the parent, there's some really handy resources within this page that, you know, you can either give to the client, your client, that you can talk through with them. You can encourage them to read and review. So, you know, these are some of my favorites for when there are children in the home where there is mental illness. So I appreciate your time today. Please let us know if you would like a follow-up didactic on this topic, because that's something that we'd be happy to provide.